Imagine getting gum disease treatment for $250 instead of $2,500. Yes, this isn't a typo, it's Mexico. Here's how you can save your teeth and your wallet. It's a ray of hope for those struggling with the high cost of treating periodontal disease. Hey, I'm Ron. In this video, we'll explore how you can get affordable gum disease treatments in Mexico in just one short trip. We'll discuss the four major treatment options, their cost, and the treatment process in Mexico. So why consider treatment in Mexico? Well, did you know that up to 30% of Americans don't have dental insurance? Even with dental insurance, advanced periodontal treatments can cost up to $2,500 per quadrant. With an annual insurance maximum of $1,500, you won't even cover one quadrant, let alone a full mouth treatment, which can total $10,000. Due to these high costs, many people postpone the treatment, believing it's either hopeless or financially out of reach. However, untreated gum disease only gets worse over time. The longer you wait, the more costly it is to treat them. Gum disease or periodontal disease or periodontitis causes oral hygiene issues that can lead to bad breath and the loss of self-confidence. It's also linked to serious health conditions like heart disease and dementia. The bacteria causing gum disease can spread to the bloodstream, contributing to these diseases. Worst of all, periodontal disease can result in tooth loss, leading to the need for dentures or more extensive and expensive treatments like full mouth dental implants. But you have a great and affordable alternative. Many people don't realize that they can address their gum issues in just one short trip to Mexico and save about 90% on the treatment cost. This significant cost savings can provide a huge sense of relief. Let's discuss the four options to treat gum disease, their cost, and the process. Feel free to drop any questions or comments below. I read each one and enjoy connecting with you all. If you're considering gum disease treatment in Mexico, I encourage you to take the next step and call us at Deo Dental so we can get you started right away with a reputable periodontist. So here are the options. Option 1, deep cleaning. Deep cleaning, also known as scaling and root cleaning or SRP, is a comprehensive dental procedure that removes plaque and tartar below your gum line. This treatment helps reduce gum inflammation and promotes healthier gums and teeth. Deep cleaning is the most common treatment for early stage periodontal disease. How much does it cost? Gum disease or periodontal disease treatments are quoted on a per quadrant basis. The mouth is divided into four quadrants: the upper left, the upper right, the lower left, and the lower right. In the US, deep cleaning costs around $300 per quadrant without insurance, plus approximately $180 for the cost of your consultation and x-ray. The total cost for a full mouth treatment is about $1,400. Typically, deep cleanings can be performed with a general dentist. Seeing a periodontist specializing in gum disease treatments can increase the cost. In Mexico, all periodontal treatments are performed by a periodontist. The average cost is around $150 per quadrant or $600 for a full mouth treatment. Typically, the consultation and x-rays are included. Here are 2 tips when getting deep cleaning in Mexico. Book with a periodontist for your first visit. Unlike in the US, deep cleanings are exclusively done by periodontists in Mexico. Ensure that you book your appointment with a periodontist for gum disease problems. Schedule the deep cleaning right after the consultation. You can get this procedure done in one visit in Mexico, often in just one day. By booking with a periodontist, you can start and complete the procedure right after the consultation. The process takes about 1 to 2 hours, so it's relatively easy. Option 2, LANAP. LANAP, or laser-assisted new attachment procedure, is a cutting-edge treatment for gum disease that utilizes specialized lasers. This technique removes diseased tissue and bacteria from periodontal pockets while preserving healthy tissue. It also stimulates regeneration of bone and gum tissue. If you qualify for LANAP, it offers a less invasive procedure with a faster recovery time than traditional methods. However, it's important to note that LANAP might be combined with traditional deep cleaning methods or require additional pocket reduction surgery for more advanced cases. Here's the cost comparison. LANAP is significantly more expensive in the US, averaging around $1,000 per quadrant or $4,000 for a full mouth. The cost is more than 3 times that of a traditional deep cleaning or SRP. In Mexico, the price difference between deep cleaning and LANAP is really minimal. You'll pay around $150 per quadrant for deep cleaning and $180 per quadrant for LANAP. This small $30 difference for advanced laser technology is really quite remarkable. Therefore, a full mouth LANAP treatment in Mexico costs about $720 which is a savings of $3,280 or approximately 80% compared to the US. Here's the tip: follow your periodontist's advice. While LANAP is a less invasive option and often preferred for its comfort, it's essential to follow your periodontist's recommendations for your specific case. We see some patients that only ask for LANAP, but sometimes traditional deep cleaning mechanical methods may be necessary alongside LANAP, or pocket reduction surgery might be required for a thorough treatment. Option 3. Pocket reduction surgery. Pocket reduction surgery is a procedure designed for moderate to advanced periodontal disease. During the surgery, a periodontist pulls back your gum tissue to access and remove bacteria, infection, and damaged bone beneath the gums. This procedure thoroughly cleans your gums and is often the only effective treatment for severe gum disease. Pocket reduction surgery, sometimes called osteosurgery or gingival flap surgery, is performed by a periodontist and can be done under local anesthesia or IV sedation. Here's the cost breakdown. In the US, pocket reduction surgery is notably more expensive, costing around $2,500 per quadrant or around $10,000 for a full mouth treatment. If IV sedation is used, it can add another $2,500 to the overall cost. In Mexico, however, the cost is not just significantly lower, it's more like dramatically lower. The procedure is priced around $250 per quadrant, making the full mouth treatment at only about $1,000. IV sedation in Mexico is also dramatically more affordable, costing around $600 compared to the $2,500 or so in the US. This vast difference in pricing can be attributed to various factors, including lower overhead costs and differences in educational expenses. For instance, a US periodontist may have $1 million in student loans, whereas the counterpart in Mexico may have 0 student loans. For more insights on this cost comparison disparity between the US and Mexico dental care, check out my video around this topic. Pocket reduction surgery can be completed in as little as a 2-day trip to Mexico. Well, you have 2 options. Option 1, pocket reduction surgery with local anesthesia. The procedure can start immediately after your consultation, and it typically takes about 1 hour per quadrant. The periodontist may treat the upper jaw on the first day and the lower jaw on the following day, all while under local anesthesia. Option 2, pocket reduction surgery under IV sedation. You can choose IV sedation for this procedure, where sedative drugs are administered intravenously. This option keeps you semi-conscious but unaware of the procedure and ensures you feel no discomfort. Your dentist can do all the 4 quadrants in one 4-hour surgery block under IV sedation. Here are some tips. Consider bringing a companion for IV sedation surgery. It's important to have someone to help you drive after the procedure. If not, consider staying at a local hotel in Mexico close to your dental office. Avoid taking blood thinners right before your surgery. If you have systemic diseases such as diabetes, get a medical clearance from your local doctor first before going to Mexico and undergoing IV sedation surgery. I included a link below on how to prepare for oral surgery in Mexico. Option 4, extractions with dentures or implants. Sometimes severe periodontal disease may leave you with no option but to extract all your teeth. In many cases, some of your teeth have already come loose or maybe have come out. There are not enough bone attachments to save your teeth. In this situation, your last resort would be to extract all your teeth and replace them with dentures or full mouth dental implants. Both procedures will give you an opportunity for a fresh start. The procedures become more costly, especially when you're looking into getting dental implants. But again, there are tremendous savings by choosing Mexico. Let's compare the cost in Mexico and the US. Extractions in the US cost around $300 per tooth, while those in Mexico cost around $80 per tooth. Regular dentures cost around $2,400 per arch or $4,800 for the full mouth in the US. In Mexico, they cost around $500 per plate or per arch, or $1,000 for the full mouth. Many don't want to wear dentures for the rest of their lives. Dental implants are definitely the way to go, but this is where the cost becomes prohibitive for many Americans wanting to have a fresh start as a result of a perio problem. The average cost of a single-tooth dental implant with the crown in the US is around $5,000. The average cost in Mexico is around $1,600 per tooth. The average cost of full-mouth dental implants in the US ranges from $40,000 to upwards to $70,000. In Mexico, the average is between $10,000 to $30,000. These are full-mouth dental implants. The savings can be substantial for the same treatment. With Deo Dental, you can receive US quality care, if not better, while benefiting from these significant savings. Here's one crucial tip for moderate to advanced periodontal disease. Extracting your teeth should always be the last resort. It's irreversible. Nothing compares to your natural teeth. Whenever possible, avoid extracting all your teeth. The concern is that you might encounter a dishonest or overly aggressive dentist who recommends just extracting all your teeth and replace them with implants, even though your natural teeth can be saved with other periodontal treatment and other procedures. At Deo Dental, we frequently see patients taking full mouth implants when their teeth are still in good condition. They're often relieved to learn that their teeth can be saved, allowing them to avoid extensive surgeries and the high costs associated with full mouth dental implants. Well, how do you avoid this? Get a second and third opinion from other periodontists who are opting for full mouth extraction. Get a local consultation with the periodontist in the US before going to Mexico for gum disease treatment and survey the answers. Do you really need to go? Do your teeth really need to go? So if you've been putting off gum disease treatment due to sky-high cost, Mexico might just be your solution. Why pay $2,500 in the US when you can get top-notch care for as little as $250 south of the border? Ready to make a change? Call us here at Deo Dental. We connect you to some of Mexico's top periodontists at the prices we just discussed. With just one visit, you can start the healing process of your gum disease. Hey everyone, thanks for watching today's video on affordable gum disease treatments and options. I hope you found it helpful and informative. And if you enjoyed this video, please give it a thumbs up and don't forget to subscribe to my channel for more great content like this. I really appreciate all your support and love, and I love reading your comments. So let me know what you think about today's topic in the comments below. Take care, everyone. Bye for now.